Welcome to Brainetainment, your go-to channel for all things health and wellness. Today we uncover the mystery behind acid reflux. Now you might be wondering, what exactly is acid reflux? Well, it's a common condition that many of us experience, but perhaps don't fully understand. Acid reflux, otherwise known as gastroesophageal reflux disease, or GERD for short, is more than just an occasional heartburn. It's a chronic condition that can significantly affect your quality of life. In the next few minutes, we'll delve deep into this topic, exploring everything there is to know about acid reflux. We'll uncover its causes, identify its symptoms, and explore effective treatments. By the end of this video, you'll not only have a comprehensive understanding of acid reflux, but also the tools to manage it, should you or a loved one be affected. Stay tuned as we dive into the world of acid reflux, its causes, symptoms, and treatments. So, what exactly is acid reflux? It's not as complicated as it sounds. Imagine you've just indulged in a hearty meal, and soon after you feel a burning sensation creeping up from your stomach, making its way to your chest and even your throat. That, my friends, is the classic manifestation of acid reflux. In the simplest terms, acid reflux, also known as gastroesophageal reflux disease or GERD, is a condition where stomach acid or bile flows back into the food pipe, irritating the lining. It occurs when the lower esophageal sphincter, a ring of muscle at the entrance of your stomach, doesn't close properly after you swallow. This allows stomach acid to escape back up into your esophagus, causing discomfort. Now, the stomach is designed to handle this acidic environment, but the esophagus, not so much. It doesn't have the same protective lining, so when it's exposed to the acid, it can cause inflammation and pain, creating that familiar heartburn sensation. It's like a faulty one-way street. The food should only be traveling down this road, from the mouth to the stomach. But when this road starts working both ways, allowing stomach acid to travel back up, we run into trouble. Acid reflux isn't just about discomfort, though. If left unchecked, it can lead to more serious health issues, like esophageal ulcers or even cancer. That's why understanding acid reflux is crucial. It's more than just an inconvenience, it's a potential health risk. So why does this happen? A variety of factors can weaken or loosen the lower esophageal sphincter, causing acid reflux. These can range from diet and lifestyle choices to certain medical conditions. Just remember, our bodies are complex systems, and even something as seemingly simple as acid reflux is a sign of this intricate interplay. It's our body's way of telling us something isn't quite right. So now that we know what acid reflux is, let's explore what causes it. Many factors can lead to acid reflux. Some may surprise you. Let's dive into the common culprits. A significant cause of acid reflux is what we consume. Certain foods and drinks can trigger this condition. Spicy and fatty foods, alcohol, coffee, chocolate, and even peppermint are all known offenders. They can relax the lower esophageal sphincter, a muscle at the junction of the esophagus and stomach, allowing stomach acid to flow back up. Another dietary factor is overeating. Large meals can put pressure on the lower esophageal sphincter, forcing it open and allowing stomach acid to escape. Eating too close to bedtime is another trigger. Lying down after a meal can cause the stomach contents to press harder against the sphincter, increasing the chances of acid reflux. Next up are lifestyle habits. Smoking, for instance, can weaken the lower esophageal sphincter, making it easier for stomach acid to flow back into the esophagus. Lack of exercise and a sedentary lifestyle can also contribute to acid reflux. Regular physical activity helps to keep the digestive system healthy and functioning properly. Certain health conditions can also lead to acid reflux. Obesity puts extra pressure on the stomach and can cause the lower esophageal sphincter to open, allowing stomach acid to flow back up. Pregnancy, due to the increased pressure in the abdomen, can also contribute to acid reflux. Conditions like hiatal hernia, where a part of the stomach pushes through the diaphragm into the chest cavity, can also cause acid reflux. Certain medications can also trigger acid reflux. These include drugs for high blood pressure, sedatives, antidepressants, and even common pain relievers like aspirin. Lastly, stress and lack of sleep can aggravate the symptoms of acid reflux. While they may not directly cause it, they can exacerbate the condition, making it more difficult to manage. Knowing the causes is half the battle. Recognizing the symptoms is the next step. Acid reflux can manifest in many ways. Here are some signs to look out for. One of the most common symptoms of acid reflux is a burning sensation in the chest, often referred to as heartburn. This feeling can be so intense that it's mistaken for a heart attack. You might feel it creeping up your throat, creating a sour or bitter taste in your mouth. It's typically worse after eating, especially after a large meal or spicy foods, and can be exacerbated when lying down or bending over. Another symptom is regurgitation, which is the sensation of acid backing up into your throat or mouth. Regurgitation can produce a sour or bitter taste, and you may also experience a wet burp or even vomit some contents of your stomach. Acid reflux can also cause dyspepsia, a general term for stomach discomfort. People with dyspepsia may feel bloated, have a feeling of fullness even when they haven't eaten much, or they may experience stomach pain or discomfort. Another common symptom is a dry, persistent cough or hoarseness. This can occur due to the irritation of the voice box and throat by the stomach acid. It's often worse during the night or first thing in the morning, and it can interfere with sleep. In some cases, acid reflux can lead to difficulty swallowing, a condition known as dysphagia. This happens when the esophagus becomes so inflamed that it narrows, making it difficult for food to pass down. More severe symptoms can include chest pain, especially when bending over, lying down, or eating. In rare cases, people may even experience symptoms such as wheezing, shortness of breath, and even a sore throat. It's important to remember that not everyone who has acid reflux will experience all these symptoms. Some people may have it without even realizing, as the symptoms can be mild or infrequent. If you're experiencing these symptoms, don't panic. There are treatments available. Acid reflux might be uncomfortable, but there are ways to manage it. The journey to managing acid reflux often begins with lifestyle changes. Sometimes what we eat, drink, or how we sleep can trigger this condition. For instance, foods that are high in fat, spicy, or acidic can exacerbate acid reflux. Reducing the intake of these foods can be a good start. In addition, eating smaller, more frequent meals and not lying down immediately after eating can help. Drinking alcohol and caffeine, as well as smoking, can also contribute to acid reflux. Cutting down on these habits might make a noticeable difference. Physical activity is another vital aspect. Regular exercise can aid digestion and reduce pressure on the stomach, thereby reducing the chances of acid reflux. However, when lifestyle changes aren't enough, over-the-counter medications can come to the rescue. Antacids, for example, can neutralize stomach acid, providing immediate but short-term relief. H2 blockers and proton pump inhibitors, on the other hand, reduce the production of stomach acid, providing longer-lasting relief. It's important to remember that these medications should be used as directed by the manufacturer or a healthcare professional. Misuse can lead to unwanted side effects or mask more severe underlying conditions. In some cases, acid reflux could point to a more serious condition called gastroesophageal reflux disease, or GERD. If your symptoms persist despite lifestyle changes and over-the-counter medications, it may be time to see a doctor. They can provide a proper diagnosis and prescribe stronger medications or recommend surgical options if necessary. Also, don't forget to pay attention to your body's signals. If you experience symptoms such as difficulty swallowing, unexpected weight loss, persistent vomiting, or blood in your vomit or stool, seek medical attention immediately. Remember, acid reflux might be uncomfortable, but it's not insurmountable. With the right knowledge and tools, acid reflux can be managed effectively. Let's recap what we've learned about acid reflux. It's a common condition where stomach acid flows back into the esophagus, causing discomfort and, if left untreated, potential health complications. We've delved into its various causes, including certain lifestyle choices and physiological factors. Remember, common symptoms may include heartburn, regurgitation, and even difficulty swallowing. We also covered several treatment options. Lifestyle modifications can often help, such as maintaining a healthy weight, avoiding trigger foods, and not eating close to bedtime. Medical interventions, including over-the-counter antacids and prescription medications, can also provide relief. In severe cases, surgical procedures may be warranted. The importance of recognizing these symptoms and seeking appropriate treatment cannot be overstated. After all, your health and well-being are paramount, so if you or someone you know is experiencing these symptoms, don't hesitate to reach out to a healthcare professional. That's all for today on Brainetainment. Don't forget to subscribe for more health and wellness insights. Until next time, stay healthy.